First call.
ज्वाइन करो सारे लोग।
श्वेता मेरा देखो हम कैमरा चालू कर रहे हैं, ठीक है? कैसे?
तो हम लोग पार्टिसिपेट कर सकते हैं यार। क्या दीदी?
सुनाई दे कुछ बोल नहीं का।
Good afternoon, teachers.
All right, good afternoon, everyone. I am Ravindra, Treasurer, Petunia Chapter 14, National Scholars Society, and Assistant Professor, Savitri Hospital and Paramedical Institute, and moderator for today's program. On behalf of Chapter 14, Petunia, UP, National Scholars Society, I would like to welcome our eminent guests present here with us. Participants, which includes principals, vice principals, professors, associate professors, assistant professors, clinical instructors, nursing tutors, and students of various colleges. This virtual seminar is about International Childhood Cancer Day, which is supposed to be on February 15th of every year. It is a global collaborative campaign to raise awareness about childhood cancer and to express support for children and adolescents with cancer, the survivors and their families. Moving forward, I would like to request Ms. Tarangini Maurya to welcome our guest of honor, Professor Binu Jo, President, National Scholar Society.
Thank you, Arpit sir.
One second, Tarangini ma'am. Tarangini Maurya, presently working as Assistant Professor in Hospital in Paramedical Institute, Gorakhpur. Her specialty is medical and surgical nursing. She is a registered nurse of Uttar Pradesh Nurses and Midwife Council. Her total experience is of 4 years, clinical 1 year, teaching 3 years. She is also the life member of the Nursing Scholar Society India. Over to you, ma'am.
Thank you, sir, for introducing me. I am very happy to take this opportunity to introduce a very important person of NSS team. The president, he is the president, Professor Binu Joy, sir. So NSS President Binu Joy, sir, he is a registered professional nurse having 16 years of experience in a variety of nursing settings. He is currently working as a principal at Christ College of Nursing, Jamnagar, Rajkot, Gujarat. Sir is a gold medalist in MSc Child Health Nursing. Sir has got distinction in research presentation, and also he has published 20 research papers and referred journal at national and international level. Joy sir has participated, organized, conducted many workshops and conferences. He have received first prize in poster sessions. Recently, he has published Child Health Nursing textbook for GNM and statistic books and community records for BSc nursing students. He is a life member, board member, and chapter president of many societies and associations. So I would like to invite Binu sir to give blessings and messages to the inductees. Over to you, sir.
Thank you. Thank you very much. I'm very happy to see so much, many delegates who have joined us for the conference. Respected dignitaries, Dr. Suresh Narula Khanna ma'am, Patron of Nursing Scholar Society, in its absence, Mr. Vedmuthi sir, who is the speaker of today's section, Mr. Santosh sir, President of Leukemia Chapter of Nursing Scholar Society in UP,
Start video.
Organizing Committee for the conference, Dr. Shweta Rani, Mrs. Neelam Rai, Mrs. Tarangini Maurya, and dear delegates, a warm greetings of the day. I'm very much thankful to Mr. Santosh sir for organizing such a wonderful conference, which is the need for of the hour. Thank you, sir, for the great initiative which you have done to conduct such a conference. As I was saying, that International Childhood Cancer Day is celebrated every year on February 15. International Childhood Cancer is a very global campaign which was started to raise awareness among childhood cancer, to express support and solidarity with this group needs, especially among the children and adolescents who are suffering with cancer, the survivors and their family members. The theme of this year is better survival, which is achievable through your hands, which means to provide right care at the right time and the right team. So it is a great, we need to have a proper care, which is a need for our in the management of children with childhood cancers. As we know, every 3 minutes, a child is suffering with cancer, is dying. And it is one of the leading causes of death among the children and adolescents. So I will not take much time in talking about childhood cancers because we have our expert speaker, Mr. Vedmuthi sir, who will be enlightening us regarding the childhood cancer, and hope all the delegates will get maximum benefit through the sir's talk. Taking furthermore few minutes among you all, I would like to talk about you Nursing Scholar Society, which is in the heart of all my team members. Nursing Scholar Society was started with a great determination of Dr. Suresh Narula ma'am. And I'm proud to say that she is the lady behind this society and she is the nightingale of this society. So with the collective effort of the other great team members, the vision of the Nursing Scholar Society was started and Nursing Scholar Society was registered, and aim of the Nursing Scholar Society is very simple, that is care to the caregivers. During this tough COVID-19 pandemic which we are seeing, we have seen that many of our nurses were frontline heroes. They were frontline COVID warriors to fight various pandemics. They were the real heroes. So when this COVID pandemic started, this thought of our mind arose. The nurses are working in such a conditions where there were many pitfalls, there were many negligence during this COVID-19 pandemic. But in spite of all this, I think our nurses, without demanding anything, they have worked for the society and for the humankind. Without priorities, human care. They have kept their own personal motives and personal interests behind. The motive of the patient health and society health was very high. So the nurses were the real heroes in this tough COVID-19 pandemic. So we started this society with the initiative that is very simple, care to the caregivers. We have a very strong team of members who have come forward, who made this reality to happen. The vision of nursing, the vision of our patron ma'am, Dr. Suresh Narula Khanna ma'am, the like-minded members came forward and they made this reality. Nursing Scholar Society happened and established in the year 2021 at the first induction ceremony that was held in December 28. We led the establishment of Nursing Scholar Society in the year 2021. Out of we have a strong team, and also we have total 8 chapters. We have total 8 chapters of Nursing Scholar Society which has established and formed. The induction of that society is over and the members of that society are inducted in the Hall of Fame. 8 to 10 more chapters of Nursing Scholar Societies are also establishing in various areas of the country. The Petunia chapter, the President Sir, Mr. Santosh Sir, and his great team is already dedicated for the service. We have a great team, that is Mrs. Neelam Rai ma'am, and of course the great team behind who have worked behind for the formation of Petunia chapter in UP. The induction of the chapter will be also laid down very soon on 27th February of this month, and all the members of UP chapters will be inducted in the society and also in the Hall of Fame of the society. So this is in brief about the society. You can visit our website or contact any one of us if you are interested to be part of Nursing Scholar Society. It is only together we can make a change. We alone can, we all together can make a change. With this few words, the nursing, I would like to congratulate all the members, all the organizing members for conducting such a wonderful conference. And thank you for inviting me an opportunity to talk in front of you, such an energetic peoples, smiling peoples who are attending conference from, I am seeing some nook and corners of the world. They are in, some are outside also, they are coming and attending this conference. That's a great skill. Learning can take place at anywhere, at any time, anywhere. But the interest of a learner is the most important. If you have an interest, learning can take place at anywhere and anytime. That is what I feel and hope you all will agree. So thank you all once again for providing me an opportunity to talk to in front of you all. Thank you. Thank you.
Thank you for your wonderful words.
Thank you,
And now
sir.
I would like to tell you, due to some unavoidable circumstances, Dr. Khanna is unable to join this event. Still, I would like, if I could have a little moment to introduce her. As you can see, she's a patron Nursing Scholar Society, patron of Nursing Scholar Society. Dr. Khanna has obtained EDD in maternal child health and from Columbia University, New York in USA. She has over 50 years of professional experience in her roles and in a variety of nursing settings. She is a retired emeritus professor and involved in 4 prestigious societies as patron in India, and they are Nursing Honor Society, headquartered is in Indore, Clinical Nursing Research Society in Mount Abu, Nursing Teachers Association in Gwalior, and Nursing Scholar Society in Rajkot, Gujarat. She has published and presented extensively and authored the classic book of history of nursing in India and nursing leaders. She has been working closely for TNII as overseas branch president of USA and Canada and had been national TNII NGO representative at the United States for years. I would like to inform you all this. She is not with us because there were some unavoidable circumstances and she could not join this. Hence, moving ahead, President Chapter 14, Petunia, Uttar Pradesh National Scholar Society, to kindly welcome our guest speaker for today's program. As you can see, Mr. Santosh SU is a PhD nursing scholar and working as principal in Ganga Shield School of Nursing, Bareilly, UP, India. His area of specialization is MSc in pediatrics nursing and MBA in hospital management. His strengths are of communication, self-motivation, innovation, research, etc. He has moderated many conferences and participated in national and international conferences and workshops. He has published many research studies and is also on the editorial boards of many referred journals. Members of many associations and organizations, including TAI, IASS, and PNNFL. He has also received Research Excellence Award in UIJIR Academic Research Foundation. He is also a governing board member of medical faculty now. As chairperson of special events, NSS headquarters, president of NSS chapter 14, and chapter 2, Jasmine. Over to you, sir. Kindly welcome our guest speaker for today.
Thank you, Mr. Arpit, for the brief introduction. Myself, Santosh, and today I'm going to introduce our chief guest, chief speaker for you all, Mr. Vedmurthy. He is currently working as an associate professor and HOD in the Department of Pediatric Nursing, Faculty of Nursing, SGT University, Gurgaon. He has over 12 years of teaching experience in various institutions and universities, and he is associated with professional organizations like IANN, Indian Association of Neonatal Nurse. He has participated in more than 30 national and international conferences and workshops. He has 5 research paper publications in referred national and international journals. He has handled various roles and responsibilities in various colleges and universities throughout his career. As today's topic, you all know that International Childhood Cancer Day. It is celebrated every year on the 15th February. And to highlight the dangers and impacts of this deadly disease among the children, and it's going to cause around more than 4 lakhs children and adolescents below the age of 20 years are diagnosed with the cancer. So let me introduce our guest speaker, Mr. Vedmurthy sir, to brief on this childhood cancers. Vedmurthy sir, we welcome you for the event. Kindly take the screen. Vedmurthy, sir.
Hello.
Yes, sir.
Sir, it is audible?
Yes, audible.
Yeah, good afternoon, sir. Thank you for a brief introduction about myself. Shall I share my screen, sir?
Yes, you can share, sir. Mr. Arpit, please stop sharing the screen. Okay.
Yeah, is it visible? Hello.
Yes, it's visible, sir.
Is it visible now? Okay.
Yeah.
Yeah, myself, Mr. Vedamurthy, Associate Professor from Department of Child Health Nursing, Faculty of Nursing, STT University, Gurugram and Haryana. Today we are discussing regarding I'm just briefing out about the childhood cancer disorder, because as we know, this is a vast topic. It is not possible to cover in a single session, but I will just brief you out regarding childhood cancer. I extend my thankful to the Surel Narella Khanna ma'am. She is the Senior Advisor of Nursing Scholars Society, and Professor Binu Joy, President of National Scholars Society, and Mr. Santosh sir, the President of Petunia, that UP branch, and his organizing team, for giving me an opportunity for present regarding a brief overview regarding childhood cancer. And as beginning from Binu sir told, and Santosh sir also is told, every year 15th of February we are celebrating International Childhood Cancer Day. And this year main theme is better survival in achievable through your hand. You know what is the reason why they are given this theme? If you will see overall, the 80% of a developed country having a survival rate compared to an underdeveloping countries. Underdeveloping countries having a survival rate, we can see only a 20%. And a developed country having a survival rate more, 80% is there. Why it is there means it is due to an early identification and starting of a treatment disease condition. That's why the theme of this year is better survival. They also can be survived if it has been identified in an early stage. And just an introduction regarding the pediatric pediatric cancer have been an area where it has been a neglected area, and it is present throughout world and maybe globally. The major of the cancer disease has been identified only in an adult condition, but it is also present in a children conditions also. Pediatric cancer is accountable is less than 5% of all the cases. Is 100% of cases is there in a cancer means in that 5% of cases is only a pediatric disease condition. Globally, we can see 4 lakh cases is detected every year. Every year, 4 lakh cases is only a pediatric cases has been identified, those who are suffering from the cancer of various type of the cancer disease condition. But in a that is 4 lakh is globally. But if you are coming about the Indian statistic, every year the 45 to 50,000 new cases has been diagnosed. In many countries, it is the cancer. It is one of the second most leading cause of a death in a children in a first year of life. And you think we are discussing regarding the entire pediatric department. It is from the beginning to 19 year of age, but it will be in 1 year. We can see many deaths due to a cancer disease condition. And the last year, the ICMR given the report saying that 7.9% of cancer cases in India were recorded. That is only, it is telling that recorded, because many cases is there, still it has not been recorded. If we will see the statistic in between 2012 to 2019, 6.10 lakh cases has been identified. That is the overall cancer rate I am telling. That is in that 52.4% is male and 47% are the female, which is being recorded in the National Cancer Registration Program, which is under this program. In that childhood cancer, that is 0 to 14 year only they considered, it consists of 7.9% of the cancer recorded under the report has been conducted by the hospital-based cancer registration in 2021. If you will see the definition, it is the simple one. A term usually describe the cancer means it is one of the deathful disease condition or maybe a chronic disease condition where this condition can be from the birth to 14 year of age. Sometimes it may include, sometimes we will include because adolescent also included in the pediatric department. That's why in between 15 to 19 year also we are including in this condition. Cancer in children can occur anytime or any part of the body, which normally may include the blood, lymph node, any other lymphatic system, blood, spinal cord, kidney, and other organ, or maybe the tissues. Okay, now they are given the different color of ribbon for the cancer disease condition. Normally for children, as we know, is a golden color is given for the childhood cancer, and other color is also given for other disease condition, like yellow is given for the bone marrow or the maybe the bladder cancer, then uterine cancer, leukemia. Other color is given, but normally for the childhood disorder, we will be using the golden color. What may be the causes for this, the childhood cancer? If we will just see the statistic of the causes of childhood cancer, more than 75% to 90% of the cancer is unknown. There is no any specific reason for having a cancer disease condition, but only a 20 to 25% we can say few may be the causes for having a childhood cancer. What all are these few may be that we will see? We will see what may be the 10 to 25% of the causes. The next cause is maybe ionizing radiation. Normally, we will tell about ionizing and non-ionizing radiation, all the type of radiation, especially the ionizing. We are seeing about the alpha, beta, gamma, delta. These all the radiation will affect. What it will do means it will change the chromosomal sequence or maybe genetic sequence of the cell that will leads to, we will call it as a mutation. Once the mutation will be takes place, means that will leads to the cancer disease condition. It's occurred due to a ionizing radiation. Other also is there the radiation like non-ionizing radiation, but it will be not having that much impact. It will not leads to a cancer disease condition, but it will lead some changes in a cells or maybe tissue, we can say it. This is regarding an ionizing radiation that will cause the cancer. The second one is the chemical or maybe a drug. Some chemical or maybe a drug, usually it will change the DNA sequence. That's why especially they will tell those who are having a pregnant mother, they should not consume a tobacco, they should not consume a smoking, avoid any unnecessary medication. Why? It means these unnecessary medication are maybe they are consuming a smoking or maybe a drug. This will change. It may be a lifestyle, but it will change the some tissues or maybe cells in an individual. That's why some drugs may have a carcinogenic effect, means a harmful effect over the child when they have administered to the mother during a pregnancy. Tobacco may include the tumors or maybe it may affect the central nervous system when consuming during a pregnancy. While alcohol and other some diuretic medication drugs also may having a child to get the tumors like Williams tumor, neuroblastoma can occur if the mother is consuming with a chemical or maybe a drugs. The next cause is a biological factor. If the mother is came to across with any type of the infectious disease condition or bacterial condition or maybe the viral disease condition, which will make it will indirectly, it may not be a direct or indirectly affect the child growth also, because mother and child will call it as a one unit. That's why if anything is occurred during a mother at the time of pregnancy, it will indirectly affect the child growth. That's why the mother should be take precautionary measures to avoid all these type of infectious which can be occurred during a time of pregnancy. Some of the infectious viruses like epistrum virus or maybe vaccines or maybe human immunodeficiency HIV, hepatitis B, C, human T cells or human papilloma virus. Many virus may associated will leads to the child to get the cancer. The next is ecological factor, that is a genetic factor. As we know, Mendelian theory, it will law of inheritance, that is transferring any type of disease condition to one generation to another generation. If the mother side or maybe a father side, anyone suffering from any type of the genetic disorders, or they are maybe suffering from the cancer cells or maybe cancer, it will flow from one generation to another generation. Maybe, may not be, it is not 100% sure that they may get the type of cancer disease condition. This is also one of the factor. These are all the few, that is 10 to 25% we can call it out, but rest of all 70% to 90% is unknown cause. What are the 3 to 4 the causes, or maybe we can call it as a risk factor? Is the first one is ionizing radiation, and the next is maybe any type of chemical or maybe drugs which has been consumed, or any type of the virus, infectious bacteria that during a time of pregnancy if the mother is receiving, or the next is the genetic factor. These are all the main factor we can call it, or maybe ecological factor will leads the child to get cancer. We are telling about the child may having any type of the cancer. These are the main few more the frequently occurring the cancer in the children, that is leukemia, lymphoma, tumor in central nervous system, or we can call it as a brain tumor or maybe brain cancer. Then the Wilms tumor, neuroblastoma, osteosarcoma, Ewing sarcoma, retinoblastoma, Risenberg syndrome, or maybe the germ cell tumor. These are all the cancerous that commonly has been seen in the children. We will discuss one by one shortly. First, we will see regarding the leukemia. Leukemia, as we know, this is the blood disorder. It's occurs. Maybe when we will tell about the blood disorders, it's mainly the component RBC, WBC, and the platelets. But in the leukemia cells, leukemia cancer, it is the blood disorder. It most commonly formed in a children. Main 80% of the condition in the children cancer is the leukemia. When a child is having a leukemia, bone marrow, I think you all know bone marrow is the area where the blood has been produced in the body. When the bone marrow itself has been affected and the cell which has been produced by the bone marrow itself an abnormal, that will lead to an abnormal production of all the blood components. When the child having a leukemia, the bone marrow makes an abnormal blood cells that does not mature usually the white blood cells, because essentially all the cells which has been generated in the body should be matured to do the normal functioning. But the matured cell itself an abnormal means it will not function properly. An abnormal cell reproduced very quickly because it required a short duration of time. That's why the abnormal production and rapidly the generation of the cells takes place in a bone marrow that do not work same as in healthy cells. In this leukemia also we are having some different types. Is there in this first is acute lymphocytic leukemia, that is we will call it as AL. This is the most commonly type of leukemia. This consists of maximum number, that is 80% of the leukemia is acute lymphocytic leukemia. And acute myeloid leukemia or myelogenous leukemia, we can call it as anything, that is acute non-lymphatic leukemia, lymphocytic leukemia also we can call it as. It is the second most leading cause of the cancer. It is 10 to 20% is the ratio, where the lymphocytic leukemia, that is 80%, and non-lymphocytic leukemia, that is 10 to 20%. In a hybrid or mixed, here the combination of both ALL and AML, that is acute lymphocytic leukemia and acute non-lymphocytic leukemia, is a combination it will come, that is the chances is less. And the next is the chronic lymphocytic leukemia. It is merely an extreme condition. It is not be seen much in the children, but it is, we can call it as an absence also, but it is also the chances is the rare condition. And the next one is chronic myelogenous leukemia. This is also the rare condition. It occurs out of 100, it is 2 to 3% of chances is. That is all the main 3 to 4 5 types of leukemia that we are seeing in a children. If the person having leukemia means, we can see these are all the symptoms, like the person may have pale in color, because hemoglobin is one of the essential for a proper functioning. The blood itself, it is not properly synthesized. It's an abnormal cell is there. That's why we can see the pale skin. Then the feeling tired, the person will be having tiredness, weakness will be is there, cold and clamping.
Vedmurthy sir, please unmute yourself.
I just unmuted, na?
Yeah.
Okay, shall I go previous slide or shall I continue with here?
Continue, sir.
Okay, some of the symptoms which has been seen in a leukemia are pale skin is there, feeling tired, weak and cold and clampy extremities, dizziness, headache, shortness of breath, then trouble in breathing pattern, then frequently a long-term infection. The child is having less immune power. That's why he will get frequently any type of infectious disease condition. The patient may having a fever, then easy in bruising or maybe a bleeding can occur. Either maybe a nose bleeding or gum bleeding, any other part. Means frequently the person is getting an infection also and the bleeding also. Bone and joint pain will be is there. Then the abdominal swelling, that is belly swelling, then the poor appetite and the weight loss, then the swollen lymph nodes. These are all the commonly seen symptoms in a leukemia condition or leukemia child, irrespective of the condition, either maybe any type of the leukemia. The next one is lymphoma. Lymphoma, it is one of the seventh most common cancer which has been seen in an adult, but it is the third most common cancer we have been seen in a children. It is representing 3.5% of all the cancer and 55.6% of the blood cancer conditions. Lymphoma is the cancer of lymphatic cells. Here itself, the lymph nodes has been affected. Our lymph node, we can call it as a lymph cells, lymph tissues like spleen, thymus, and the tonsils. These are the main organ which is having affected or maybe infections. If you will see the classification of lymphoma, it is broadly classified according to the WHO. It is given in 2001, according to the cytology or maybe the cell, how it has been infected. It is mainly, there are two types is there, Hodgkin lymphoma and non-Hodgkin lymphoma. It is because of the type of cell which is affected, on that basis only it is given, that is Hodgkin lymphoma and non-Hodgkin lymphoma. It has been developed in a specifically B type of cell has been affected in Hodgkin's lymphoma. It is acquiring 5 to 7% of 1 lakh population. But in non-Hodgkin lymphoma, it is either B itself or maybe a T cells. But in Hodgkin lymphoma, we can see only the B cell, the type is affected. In non-Hodgkin lymphoma, we can see B type and the both T cells is also an acquired. It is a unique general material. It consists of 7% of the cancer in a child in between the age of 20, from the birth to even 20 years of age. We can see this non-Hodgkin lymphoma. These are the common symptoms which has been seen in a person who is a child who is suffering from lymphoma. That is a swollen lymph node will be there. Any part of the body. It is not only a specific area, any part. Normally we can see it in a neck, groin region, and most frequently the lymphoma. Then the swollen abdominal is there. Abdominal lymph node has been enlarged. That's why we can see the swollen abdomen. Then the night sweat will be is there because this patient having the child is having fear. For cooling his body, then automatically the body cell is start to sweating so that the body will come to a normal condition. The child is having a fatigue, weight loss, and itching skin. These are all the symptoms which has been seen in the children who are suffering from lymphoma. Then the next we will see about the brain tumor. In the brain tumor, we will call it as entirely the central nervous system, where the child brain and the spinal cord is also included. An abnormal cell or maybe tissue has been developed anywhere in the brain cell, either maybe central or maybe the spinal cord. This is coming under one of the solid tumor, where the cranial cavities also will be included. The frequency of early childhood appear in the primarily 5 to 10 years of age. We can see this disease condition, but sometimes it may be decline or maybe disappear when the child is reaching to a puberty. These are the frequently seen clinical manifestation of signs and symptoms of the child who is suffering from the brain tumor. See, all these diagnoses, all these signs and symptoms is related to how the brain is functioning. Frequently, the person is getting a headache, then the dizziness is there, visual disturbance, means which part of the brain cell, which part of the cerebrum or cerebellum having the tumor has been developed, that part is sensitized and that part is not properly functioning. That's why the person is having a dizziness also, visual disturbance is there, or maybe if the vision is properly is there, then the blurred vision is there. Then the seizure also can be seen, morning nausea and vomiting, weakness or maybe a paralysis also can be occur. Then the personality changes and hearing impairment. These are all the common signs and symptoms which has been seen if the child is having a brain tumor. And the next one is the Wilms tumor. Wilms tumor, it is one of the malignant neoplasm of the kidney cell. See, organ is entirely different. Previously, we saw about the blood. The next we saw regarding the central nervous system. Now it is coming to a kidney. The malignant of this neoplasma, it is occurring in a kidney, which may be unilateral or bilateral. Either maybe one kidney also affected, or maybe both the kidney can be occur. Both the kidney can also be having an infected. It may be a most common kidney cancer, which has been seen in young children. It is a greater frequency, has been seen in between the age group of 2 to 3 years of age. It's also called as Neuroblastoma. And it has been, if it is identified early, means it is completely a curable disease condition. And 1 out of 2 lakhs to 2,50,000 children is having this disease condition. Out of 2 lakhs to 2,50,000 child, only 1 child is having this Wilms tumor. If you will see the signs and symptom, it is typically has been palpable, the mass condition, or maybe a mass can be seen in the abdominal area, normally in the kidney where it is situated in the flank region. It can be palpable, or it can be observed by the parents, or maybe the healthcare provider when they are doing a routine examination or head-to-toe examination, they can find out the palpable mass in the abdominal region. At the same time, the child may having painful micturition will be there, hematuria will be there, hypertension. Then slightly we can see in some case we can see the anemia, the fever, and the constipation also will be seen if the child is having a tumor that is Wilms tumor. Then the next is neuroblastoma. This is an extracranial malignant. It is a solid. This is also coming under one of the solid tumor, where here it is extracranial. It is related to central also, but it is away from the central nervous system, and mainly it is related to peripheral and the adrenal gland. This is the extracranial malignant solid tumor of nervous tissue. It is most frequently located in the adrenal gland and paraspinal site, where the parasympathetic or sympathetic nerve system tissues is present. It can occur at any part of the body. There is no any specifically. As we know, the nerve system is present throughout the body. That's why they are telling it. This disease condition can occur any part of the body, but some part is specifically like neck, then the thorax region, then the spinal cord, but most frequently spreading in bone marrow, lymph nodes, liver, and the skin area. This disease condition can be seen. It occurs most frequently in the age of 5 years, but averagely in approximately 2 years of age, it can be seen, and it is also an accountable of 7 to 10% of all the childhood cancer disease condition. If you see the symptom, as initially we told that it is affected in the abdomen also, then the liver area also, skin area also. That's why we can see the abdominal distension and the respiratory problem will be there. Respiratory compression will be there. As we know, when the abdominal girth is increasing, is that indirectly affect the respiratory pattern also, because the diaphragm is moving upside. That's why the breathing difficulty will be there. Then compression of the spinal cord, then fever, anemia, hypertension. Then the rarely or occasionally we may have seen a watery diarrhea and cerebral ataxia. These are the symptoms. These are the symptoms that frequently has been seen if the child is having the neoplasma. Then the next is osteosarcoma or Ewing syndrome. This osteosarcoma or Ewing syndrome is related to a bone cancer. This is the most common primary tumor in the bone. These malignant or neoplasma are more frequently seen in men, that is adolescent, and the young adult also, having an increase or maybe greater at the age of 10 years. Osteosarcoma, it is mainly developed at the edge of the long bone, where we will call it as a metaphysis region of the bone. It is present at both the end of the bones. In that area, mainly this tumor is going to develop, that is in the osteosarcoma. But in this Ewing's sarcoma can occur at any part of the bone or maybe a body. It most commonly has been seen in these bones like pelvis region, thigh, long leg, means the lower leg, then the upper arms and the ribs. These are the area where we can see the Ewing sarcoma tumor. As this infection, as this cancer disease is affecting the bone, the first and foremost, the symptom which can be identified in the patient is the pain in the particular bone which the tumor is present. The pain, we can see it out. At the same time, where the tumor is there, that particular part or maybe the area is swollen, and the more chances is frequent this fracture. These are the main three things can be identified if the means osteosarcoma or Ewing sarcoma is present. That is pain, swollen in the particular area where the bone is being affected, and the bone fracture. These three things. Apart from that, we having other cancer infections, like the patient may having a fatigue, fever, and the weight loss is also can be seen in the bone cancer. Then retinoblastoma, it is related to the eye, retina. This malignant neoplasma, it is originated in this is a primitive cell of the retina, mainly. It is 5 to 10th among all the cancers. This is ranking for 5 to 10th among all the cancers. With its the greater incidence in children has been seen in 3 years of age. Retinoblastoma can either affected one eye or both the eye. It is not like that. It is how we saw about the Wills tumor, either maybe one kidney or both the kidney has been affected. Like this here also, retinoblastoma also. Sometimes it can be unilateral or one eye or maybe a both eye has been identified. If affected both eye, it is usually diagnosed in within a 1 year. But if it has been affected for one eye, means it will take longer duration, either maybe a 2 year or maybe 3 year. It will take time. But if the child is affected with both eye, means within a first year of time itself, it can be easily identified. If affected one eye, it is tends to diagnose the later, that is in between the age of 2 to 3 years. It is due to exposure of the infectious agent, particularly by adenovirus or maybe the human papilloma virus. It is at the same time the mother is consumed less amount of vitamin A or maybe a folic tablet. They may leads to the disease condition. Then since early diagnosis, the child may get the revision, or maybe that means early, if it has been diagnosed, any type of the disease condition, if it has been diagnosed early, means we can easily treatable. If the child is having retinoblastoma, we can see these are all the signs. That is mainly in the iris region. We can see in this diagram, you can easily compare the one eye which has been normal eye and the second eye which has been affected, that is retinoblastoma. You can, where the circle is present, that the small tumor has been identified in the middle. The white color or maybe any other color has been seen in the maybe in the pupil region. When the light has been shown in that particular eye, means that the flash, the child is means reflecting that error. Then the eye that having the tumor, having a poor vision will be there, redness, swelling will be present, blurred vision also can be seen in the eye which has been having retinoblastoma. Then Retimio Sarcoma. In this malignant is mainly a soft tissue neoplasma of skeletal muscle. This is related to neuromuscular, that is the skeletal muscle. It occurs in the first 10 years of life. It's located in the various greatly at different age group also. And here we can see the bladder and the vagina primitively in the first year of life. Then the trunk and the limb after the first year of life, and the head and neck at the age of 8 years of life. How the age is increasing, like the area or maybe a part of the infection is differ. The common symptom which can be seen in this is persistent lumps or maybe swollen body part and the bulging of the eyes. Then the head means headache will be is there, nausea will be has been seen, blood in the urea, earache, sinus infection, then the bleeding from the nose, throat, vagina, or maybe a rectum area. Then the vomiting is there, abdominal pain will be there, and the constipation. These all the symptoms has been identified in this sarcoma, Retimio Sarcoma. Then the next is germ cell tumor. This is also the last one which we are seeing in the child. That is, a germ cell is mainly the malignant. This is one of the benign malignant, benign or maybe a malignant, any of this one. Sometimes benign, sometimes the malignant, the germ cell neoplasma, which can grow in a ovary or maybe the testicles in the any other sites. It's mainly leads to a 7th to 10th place out of all these childhood cancer disease condition. And it has been mainly, we can see in the peak age group is before 4 years also can be identified. If it is not identified, means at the same time, after 15 years also, this condition also can be seen. It presents with the general clinical symptoms such as the patient may show the fever, vomiting, weight loss, anorexia, and the weakness. When the tumor is located in the ovary, the most common symptom is chronic pain will be there. A mass may be felt in anywhere or maybe abdominal. It is the large produced. The patient may having a constipation, genitourinary disorder, an absence of menstruation. Hello. Absence of a menstruation if it is occurring in an ovary, and if it is occurring in a male testicles, it occur hard. It is hard, and it is slightly painful. The mass, and it is a translumination. If it is passing a light, means the reflection is not coming on the other end. Normally, the reflection is coming. Normally we can see the reflection, but in this germ cell tumor, if the light has been passed on the testicles, it is not reflecting on the other side due to tumors. How we can identify these all the type of cancer means either maybe a physical examination. Many of the disease condition can be identified with the help of physical examination through what the symptom has been shown by the patient, and a laboratory examination like blood examination, blood analysis, urine examination, urine analysis. Then main is imaginary test where the CT scan, ultrasonography, blood scan, bone scan, MRI, ultrasound scan. These are the imaginary studies which will show that tumor location, site, how much the dimension is this, how it is spreading, that can be easily identified with the help of imaging tests, that is CT scan, bone scan, MRI, ultrasound, and the X-ray. And bone biopsy also can be done to find out in any type of the production, how the RBC, WBC, the bone marrow scan, or maybe if the Wilms tumor is there, the tumor's area can be extracted with the help of biopsy. Okay, if the patient, previously we saw different type of disease condition with a few of the clinical features. How we are classifying that disease condition means if it is possibly if the patient is having a cancer, or maybe a risk of cancer, or there is no any cancer. These are the few symptoms has been if the patient is showing like fever is there, headache, bone pain is there, or bleeding, severe palms, or maybe pale will be is there, either maybe a palm or maybe a conjunctiva, hypoma is there, nodule means the node formation is there and increasing its dimension rapidly, and it is not a painless. The pain is not there, but there is a increased in the nodules. Then neurological symptoms like the patient may show convulsion, then difficulty in speak or involuntary movement is taking place, visual disturbance, palpable abdominal mass, then the hepatomegaly or maybe a splenomegaly or any area the mass has been identified and rapidly growing. If any of these symptoms, if the patient is having, it is not like that all the symptoms should be present. In that few also is present, 1, 2, 3, any of the patient having a symptoms means the patient possibly may having a cancer, and maybe a severity if it is extending more than a particular 14 days or maybe a 20 days. If the patient is having these all the symptoms, that may be a cause of a possible the cancer or maybe very severe cancer. And the second one, we will see it that if the patient having loss of appetite more than the last for few months, and the losing his weight, tiredness or fatigue is there for last more than 3 months, these all for last 3 months. Then significant night sweating is there, as previously we saw some of the disease condition having a night sweating, and mid palms are conjunctival pale will be is there, the painful lymphoma is present, and that is rapidly increasing its diameter, enlarge in any region of the body, and the sign of inflammation is there, means the person may having a risk of a cancer. These are the two different, that is the first is possible the cancer, and the second one is some may having a risk of cancer. In this condition, the person who having this symptom, the child is taken to a physician or maybe a cancer specialist, so that they can identify if really the patient is suffering from any type of cancer, or maybe it is an infectious disease condition. How we can treat this cancer means with the help of, normally as we know, chemotherapy and the radiation therapy will be given. Then the next is the surgery, hormonal therapy. The next will be the bone transplantation, then targeted therapy and immunotherapy. These are all the common 7 type of the cancer treatment which will be given. But normally in the children, we will use first is the chemotherapy, then the radiation therapy. Then only we will use for an alternatively like chemotherapy, hormonotherapy or immunotherapy will be recommended. Then the side effect of the chemotherapy and the radiation therapy, this should be informed to the parents early itself. If the patient is undergoing any type of chemotherapy and the radiation therapy, the child may show the symptoms like nausea and vomiting, anorexia, then the muscular ulceration, neuropathy, hemorrhagic cystics, then the alopecia and the mood swings or mood changes can be seen if the patient or maybe child is undergoing for chemotherapy or maybe a radiation therapy. The duration of the treatment is very according to the severity of the disease condition. Normally, we will tell if the patient having a cancer, maybe a stage 1, stage 2, stage 3, and stage 4. Each cancer, they will tell stage 1 to stage 4. It is depend upon the early if stage is there. If it is only the particular part or maybe cells or tissue has been affected, means that they will call it as a first stage. Then the second stage means the particular organ only is affected, that is stage 2. Then the organ and the surrounding is affected, surrounding the neighbor organ or maybe the which is there near to that particular organ. If you will take about the stomach, means the spleen is also affected, intestine also is affected, kidney, back is also affected. That is moving towards the surrounding organ is affected, means that is the 3rd stage or maybe 4th stage, we will call it out. Depending upon the stages, the treatment is treatment duration also will be varied. The duration will be depend upon the type or maybe stages of the cancer. It vary according to the leukemia treatment. Normally it will take 2 to 2.5 years. Osteosarcoma 1 year, retinoblastoma 6 months to 12 months, that is 1 year. Acute AML, the acute myeloid leukemia, it will take for 4 to 5 months. That is an average. It will take more.
ये पूनम मैं क्यों हम लोग के साथ ऐसा क्यों हुआ?
जाने दो यार
अब हो ही तो हो ही ना।
आखिर बता हमको ये ससुरा ठीक है मानना है ज्योति पांडे सीमा और ज्योति यादव क्यों सब इतना ज्यादा हमको क्यों कम नंबर दिया?
हमें कहाँ कम पता नहीं।
वही तो कह रहा हम लोग उतना ही कम नंबर दिया।
पार्टिसिपेंट थोड़ा सा इंतजार करिए, अभी स्पीकर का जो है उनका डिस्कनेक्ट हुआ है, वो कनेक्ट हो रहा है।
हार दू रुक रुक
यहाँ से तो नहीं मिल रहा है लिस्ट, आपको एक लिस्ट दे रहे हैं।
डाटा खत्म हो गया है और पापा का क्लास चल रहा है ना, देखो डिस्कनेक्ट हो रहा है इसी वजह से। आप वाईफाई मत लो अभी ना, आप बैठ के प्लांट का डायग्राम किया था उसमें बताया नहीं जो मैं देखा। अगर कुछ नहीं तो कैसे दिखाएंगे?
हेलो सर, डिस्कनेक्ट ಆಯ್ತಾ?
ಡಿಸ್ಕನೆಕ್ಟ್ ಆಗಿದೆ, ಮತ್ತೆ ಕನೆಕ್ಟ್ ಮಾಡ್ತೀನಿ, ಕನೆಕ್ಟ್ ಆಗ್ತಾ ಇಲ್ಲ.
ಓಕೆ, ಇಲ್ಲ ಇಲ್ಲ ಕನೆಕ್ಟ್ ಮಾಡಿ, ಒಂದಿಬ್ರು ಯಾರನ್ನ ರಿಮೂವ್ ಮಾಡ್ತೀನಿ. ಸರಿ ಹಾ बस मिल गया हमें। इसमें जाइए, आपको ऑनलाइन से निकाल के देते हैं।
Sorry for the disturbance, just it has been disconnected.
Yes sir, you can continue the session now.
Yeah. Nursing management is very important for any type of the disease condition, where in the initially we will start with the monitoring of all the vital signs frequently. As we know, frequently means every 2 hours once or 1 hour once. It is dependent upon the hospital policy. We have to check the vital signs, and we have to minimize the invasive method of the procedure, so that already the patient is there in the painful the situation. That's why we have to avoid all the type of non-invasive or invasive procedure. Preferred for a non-invasive and avoid the invasive procedure. And encourage the child with a personal hygiene, all the type of the hygiene, maybe a regular brushing, bathing, all the personal hygiene should be encouraged. Then administer the chemotherapy medication which has been given or may be advised for a child for a particular time duration. The medication should be administered. Then administer IV fluid as prescribed if the patient is having an anemia, if it has been administered a blood component or maybe packet cells. In such case we have to go ahead with an IV fluids or maybe a blood transfusion. Then observe for the side effect of the medication. As we know, the patient one who is undergoing for the chemotherapy or maybe a radiation therapy, the patient absolutely having a side effect. Periodically we should monitor what type of the side effect the patient is showing, and we have to monitor when the side effect has there and what may be the severity of those side effects. Then administer for antibiotic if the patient is having any other type of infectious disease condition along with the cancer. In that case we have to administer the antibiotic as per the prescribed medication. Then the next is adequate balanced diet. This is one of the essential thing, as it has been identified the cancer patient is more malnourished than the other. 60 to 80% of the cancer patient have been malnourished because of loss of appetite, or maybe they are not having interest to have the adequate amount of food. That's why whenever we are giving in diet for the cancer patient or maybe the child, we have to give a small and frequent. It should be a balanced diet which is required for a child. That much should be administered. Then the next is provide a distractive or maybe a distractive therapy or maybe treatment, because as we know, this is it will take the treatment modalities. We saw it will maybe minimize to 4, 5, 6 months to it will take longer duration, 2 year or 5 year, and the child may be having fed up with all those therapies or maybe a treatment. That's why frequently we can use other type of therapies like play therapy or maybe a music therapy just to divert the child mind. The next, maintain a good hydration status. The fluid is very essential thing for all the people. Even we also is required. An adequate amount of fluid should be administered for a child. In some disease, in some cancer, we saw the patient having a sweating will be there, excess of fluid loss will be takes place. In that case, we have to give an adequate amount of excess nutrition so that it will be balanced. Then next is orient the child with a hospital setting, because when the newly they are coming to the hospital means absolutely they will be having a fear of the hospital. That's why you have to orient the child, saying that which area for a play therapy, which area for the treatment modalities, where is the room of the patient, and where the free time he can spend the time. Then next is provide an emotional support for entirely a family also and the child, which is basic and essential for a cancer patient. Then teach for the relaxation technique, how you are giving for a diversional therapy, like that we have to give a relaxational technique. Then refer the child and parent for a support group or maybe a counseling. When it has been identified the patient is suffering from the cancer or maybe any type of chronic disease condition, we have to send for a support group, or maybe we will call it as a counselor, so that they will tell about what may be the disease condition, how they will be cope up with those disease condition. That's why we have to refer the child, at the same time family members, to the counselor. The next is allow the child to ventilate the feeling regarding what may be the changes it takes place completely a duration when the first symptoms to till now, it is a long duration process. Then what are the changes the child is facing, either maybe physical changes or maybe mental changes. Sometimes the child will express low, because if any symptom, if the child is having abdominal pain is there, if the child is telling that mother, I'm having abdominal pain, then usually the mother will tell. Usually the mother will tell that I think you may have any other thing. Apart from the diet, you may have taken the fast food or maybe a junk food, which has been avoided by the parent. And if the child is taken indirectly, that may lead. That's why the child is not expressive, because in this condition, we should tell the child to express how the child is feeling. The next, identify the strength, weakness, coping skill, and the cultural preference. Because whenever any type of treatment it has been given to a child, means not only a child or maybe any adult also, we have to identify the strength, what their belief is there, what their tradition, custom. Because whenever we are giving means the nursing care, we will tell about the holistic care. We will include all the elements of the health, that is physical, mental, social, psychological, or maybe spiritual. That's why it is essential to identify the strength and weakness, or maybe how they are coping with this particular situation, and the cultural background or maybe practice which has been followed, so that we can allow them to ventilate with a particular strength and weakness. Then provide the necessary information in a common language, because sometimes if we'll tell about the medical terminologies, they will be getting more offended, or maybe they will get more the fear about the disease condition. That's why anything, if it has been informing to a child, it has been in a common language, irrespective of any place. Then educate the child and parents regarding expected side effect of chemotherapy and the radiation therapy. Initially itself I told, means anything, the changes takes place from till the beginning, because each treatment having a side effect, each medication also we are studying is having an indication, contraindication, the side effect. But some child show the side effect, some child may not be showing the side effect. That we need to identify what the side effect the child is showing. And these are some of the cancer NGOs which is working in India for providing support for a child, like Cordals Foundation, St. Jude India, Child Care Center, then Agro Mandela, then Indian Cancer Society, Can Kid and Kid Can, I think Eurosing Foundation, Sanjeevani, Life Behind the Cancer, then the Cancer Patient and Aid Association. Apart from this, many NGOs is there that will be working for a child cancer. They are giving all the type of support, either maybe a financial support or maybe a treatment support, which is essential for a child, that will be given by these foundation. And some other hospitals also is there that are free of cost. They are giving the treatment for the children or maybe adult one who is suffering from the cancer. And these are all the references which was taken the content. And I think all know about the Yuvraj Singh. He is also one of the person who suffer from the cancer. He is telling that the experience has made during this is it is actually a strange situation when any person is coming across with any type of disease condition. If you are strong, then you are automatically became a positive person. Cancer does not mean that you are going to die, because it means that it need to be identified in the early stage so that the treatment can be started initially and it is curable thing. It is not like that. That's why in the developed country having a survival rate of 80% compared to a developing country is 20. That's why he's telling that you can beat the death if it has been identified early and the treatment has been started initially. And be the part of our smile, because the child need to ventilate, and also we need to support for the cancer patient, because they're also the one of the right of the child is the right to free education and free the treatment modalities also. Thank you. Till now we discussed regarding the childhood cancer, and in that we saw many type of the cancer, especially the most frequently see the cancer disease condition in children. These are all the most frequently seen. Okay, these are all the main frequently we have been seen the cancer. We discussed these all the disease condition like leukemia, lymphoma, the tumor that is actually a brain cancer, and the Wilms tumor, neuroblastoma, osteosarcoma, and Ewing sarcoma, retinoblastoma, then Retimio Sarcoma, and the germ cell tumor. These are the frequently seen cancer in a children, and what may be the signs and symptoms the child is showing. Then the treatment modalities, how we are going to identify the disease condition, and the nursing management. And we also saw some of the NGOs which is working for the cancer, childhood cancer disease condition. Okay. If you have any doubt, you can ask me. Or you can drop the question in the chat box so that I can answer. Okay, thank you for giving me an opportunity for present regarding just a brief overview regarding a childhood cancer. And it will be an emerging disease condition, and every day keep on normal census, it will tell that every 3 minutes one cancer child has been identified. Means the need to identify early symptoms so that it can be treatable. Okay, it is not like that it is not treatable. It is also a treatable disease condition, but it's required the support of all the healthcare facility and other people also. Thank you.
Thank you, sir, for your valuable time and enlightening us with your words of knowledge regarding childhood cancer. And I am sure this would be a recognition for all of us present here on the concerned topic. Thanks a lot, sir.
Thank you.
Now, I would like to invite Mrs. Neelam Rai, Vice President, Petunia Chapter 14, National Scholars Society, UP, to kindly declare the result of poster competition, which held on February 12, 2022, amongst the nursing students of Savitri Hospital and Paramedical Institute. Mrs. Neelam Rai, she's a PhD scholar, presently working as Vice Principal in Savitri Hospital and Paramedical Institute, Gorakhpur. Her specialty is midwifery and obstetrical nursing. She is a registered nurse and midwife in Uttar Pradesh. Total experience of 10 years in the same institute. Have completed a certification course of infection prevention and control nurse. Have been an editor for a book with JP Publication, New Delhi, India. She is a life member of Nursing Scholar Society, India, and she is also a life member of Trade Nurses Association of India. Over to you, ma'am.
Thank you, Arpit sir. Good afternoon, all of you. As we all know, today we are conducting International Childhood Cancer Day. International Childhood Cancer Day is a global collaborative campaign to raise awareness about childhood cancer and to express support for children and adulthood with cancer, the survivor and their families. On occasion of this, poster competition was held on 12th Feb 2022 in Savitri Hospital Paramedical Institute in collaboration with Nursing Scholar Society Chapter 14, Petunia, Uttar Pradesh. International Childhood Cancer Day, which is celebrated on 15th Feb every year, and the theme of year 2021 to 2023 is Better Survival is Achievable. Total number of 14 participants were there in competition. GNM first year, second year, third year, and ANM first year, second year, and OT technicians year batch were included. It was judged through certain criteria such as title, labeling, neatness of organizations, illustrations, diagram, presentation skills, speaking skills, and grooming. And the winner of this poster competition was Roli Shilankur, student of GNM second year, who scored first position, and second position was scored by Tarannum Jahan, student of GNM third year. And remaining students were given participation certificate. Thank you.
Thank you, ma'am. So these are the two charts and the winners of the poster competition that held on 12th February. As we are towards the conclusion and as per schedule, I would now like to invite Dr. Shweta Rani CM, Secretary, Petunia Chapter 14, National Scholar Society, Uttar Pradesh, to kindly offer vote of thanks. Dr. Shweta Rani CM completed her PhD in nursing in the year 2021 and currently working as an associate professor in Gangasheel School of Nursing, Bareilly, UP. She is a life member of many prestigious societies, including Karnataka Nurses Council for BSc, MSc, UP Council for BSc, MSc, and NSS, SOMI, UI, JIR, and she is on many editorial boards also. She has more than 11 years of professional experience in a variety of teaching, practice, research, and administration in nursing setting. She has extensively published research papers as author and co-author. Shweta ji has participated, organized, and conducted many workshops and conferences at local, state, national, and international levels. She is a silver medalist in BSc and gold medalist in MSc studies. She was ex-member of Board of Governors of Uttar Pradesh State Medical Faculty. I would like to welcome Shweta Rani ma'am to please give vote of thanks.
Thank you, Arpit. Good afternoon, one and all. It is such an honor for me to get the opportunity to thank you all. Firstly, I would like to thank Dr. Suresh Narulla Kanna ma'am, the Chief Patron of Nursing Scholar Society, and Mr. Binu Jasar, the National President of Nursing Scholars Society for providing us the platform to organize these events. I would like to thank Mr. Santosh SU, the President of Petunia Chapter 14 of NSS, for providing immense support to make the webinar successful. I would extend my gratitude to our chief guest, Mr. Vedmurthy sir, for taking time out of his busy schedule in a short notice of period. He accepted our request and did a wonderful webinar and shared his valuable knowledge with all of us. Thank you, sir. A special thanks to Mrs. Neelam Rai, Mr. Arpit, Ms. Tarangini, and all other organizing team members for working hard in making the event very successful. I thank all the delegates for their active participation. I would also congratulate all the winners of the poster presentation competition. Once again, I thank you one and all who has contributed directly or indirectly for making the webinar successful. Thank you. Over to you, Arpit.
Thank you, ma'am. Thank you. Concluding, I would like to sign off and thank all the guests, participants, organizing committee, and to inform you that the certificates of participation and appreciation will be delivered to your registered respective email IDs within 3 to 4 days. Thank you and have a great day ahead. Goodbye.
Dear participants, you can leave the group. You will be getting this feedback link and certificates very soon. Thank you, Arpit.
Thank you, sir. Thanks a lot.
Okay, we will end the